Now here's our reporter, Lora Windsor, who has more on restoring sexual health for women.
Women going through menopause and the years around menopause may experience changes in their sex life. We spoke with Dr. Michael Krychman, who is a world-renowned doctor of sexual medicine and a board-certified gynecologist, and asked him to explain some of the symptoms of menopause.
Women may experience a variety of symptoms during the menopause when the ovaries have stopped producing estrogen. Some of these symptoms include hot flashes and vaginal dryness. Sexual health for women is really like concentric overlapping circles. Desire and arousal and orgasm certainly influence each other. So if sex is painful and it's uncomfortable, as when we see with women who have dryness, they may also experience loss of libido. In addition, besides the biological factors, very often psychological factors also play a very big role in determining whether one has sexual libido or not. Fatigue and stress and children and financial concerns and worry certainly can impact one's sexual interests and sexual drive. Very often, women will start going through menopause at various ages, and we know that even 7 to 10 years before that age of 51, women will experience some symptoms of menopause, and it can be characterized by a chaotic period where they're one time in the cycling world where they're having their periods regularly, and other times when their periods are being missed and where they're experiencing hot flashes and dryness. So very often women can experience some of the symptoms even before the ovaries have stopped producing estrogen completely. You go through the menopausal transition and you feel that your sex life is over. Very often women will see that their libido or their sexual interest will decrease. And it's not uncommon for menopausal women to experience vaginal dryness. And vaginal dryness is really associated with lowered estrogen stores. We see that the vagina loses its elasticity, pliability, and stretchability. And with some of the newer studies, very often women are concerned about hormones and they're concerned about some of the treatments, and they feel really that they're living in silence. There are safe alternatives like Replens or over-the-counter products that women can use that have far-reaching implications. They can reverse and restore the vaginal lining. They're clinically proven and they're readily available. And women should really take the first step and break that silence and really understand that sex is not just for young people. Women over 50 can certainly enjoy a very active, healthy sex life, and there are things that are safe that women can use.
Are there any other times a woman may experience vaginal dryness other than menopause?
Very often women who are using oral contraceptives or maybe using antihistamines may also experience dryness. In addition, we see that it's very common that women who are trying to conceive and or those that are going in fertility treatments like IVF may also experience dryness. Very often, lubricants have additives to them. There's warming flavors, colors, bactericides, spermicides. There's a lot of additives that can be really toxic, not only to a sensitive vaginal lining, but also can certainly impact sperm and sperm motility. But it's important for women to know that not all lubricants are created equal. And when a woman is trying to conceive or she's undergoing infertility therapy, there really is fertility-friendly lubricants that are non-toxic, that are pH balanced, that really are very important to maintain that integrity of the sperm. And Pre-Seed is really FDA proven and really recommended for those women who are trying to conceive.
If you have any questions or concerns about your sexual health issues, talk with your doctor for the proper diagnosis and treatment options. For the American Health Journal, I'm Lora Windsor.